everyone, good morning. Sound all right? Yeah. Me at the back? Okay, great. Give your arms a wiggle, half an hour till morning tea. I don't mind if you want to stand up at the back, that kind of thing. So yes, thanks for the introduction. I obviously wrote that bio myself, so that's all true. I am a PhD candidate at the University of Melbourne. I'm part-time PhD and I'm also part-time teaching on sexual health subjects. So it's really great to be here at the CERSH conference. I'll start by acknowledging also the traditional owners of the land that we're meeting on today and paying my respects. So today I'm going to be speaking about the overall topic of my PhD research. I'm looking forward to sharing this with you. So here's an overall summary of what to expect this morning. I'm going to talk a bit generally about older adult sexual health. I'm aware that we have a wide variety of people in the audience here. So for some of you, you'd be like, yeah, I know it all. For others, you're like, oh, perhaps I hadn't really thought about that. So I'm going to talk a bit about older adult sexual health. I'm going to talk a bit about the Shape 2 survey, which is a survey I've run for my PhD. And I'm going to really focus on findings and actually really focusing in on the quotes, the words themselves from participants, because I want to kind of bring to life for you these issues. And I'm going to just wrap up with some implications for practice. So when I say sexual health, I'm talking broadly. Preaching to the choir here, I'm sure, but I'm not talking about a narrow definition of sexual health. The things that I'm interested in include relationships, partnered and solo sex, things like sexual orientation, intimacy and chronic illness, intimacy after medical events, all these kind of things. So just bear in mind as I talk about sexual health today, I'm using a really broad lens. So just starting off with a few quotes to give you a bit of a sense of the real lives that older adults are living. And all the quotes I've used today are from people living in non-metro locations, so regional and rural locations, giving the focus of this conference. So we have here a woman in her 60s in regional New South Wales regarding sexual health. I have found friends reluctant to talk about these issues. In my case, I found it hard to access information on the natural signs of aging, normal parameters for bodily changes. A man in his 80s in regional New South Wales. I've had a happy long-term marriage. We had a satisfying sexual relationship until we were 75. At that age, we both suffered health issues that prevented intercourse. However, we still have a close, loving relationship. My partner had cancer and active sexual interaction wasn't a priority for either of us. Since her death 2 years ago, I have recently had a new partner and am pleased to say everything works just fine. This is from a woman in her 70s in regional Tasmania. So a bit of a summary about older adult sexual health. We've got an ageing population, as I'm sure you're aware. People are overall living longer, healthier lives, making it a bit easier to carry on their sexual lives into older years as well. Sexual expression is important for many older adults, not all. There's variety at every age group and certainly not all older adults are interested, but many are. And this is a demographic that we often asexualize or don't see as being sexual, so that's why I sort of emphasize that there. There's also sort of a changing context for today's older adults in the sense that people today have things like online dating, Viagra, all these kinds of things to deal with, which perhaps are a bit different from 50 years ago. Divorce is common, all these sorts of things. So I'm sure every generation has its own context they're working in, but today's, there are lots of changes, regarding these kinds of things around sexual expectations. As people get older, chronic illness increases. There may be medical events, for example, cancer or heart attack, and other life changes that can have an impact on people's sexual behaviours, sexual interests, and intimate relationships. And people in older demographics may have had minimal sex education in their earlier life. So despite a lifetime of sexual activity, there may actually be information gaps or certainly areas where people are not so comfortable talking or not used to discussing these things. STIs are also rising among older age groups. So we've heard this morning how STIs are rising among younger age groups, but actually this is not the only demographic that's affected. So this is a paper that I wrote with my PhD supervisors. So Sue Moulter and Meredith Temple-Smith are here today. Jane Hocking is usually here but hasn't made the conference this year. So those are my 3 PhD supervisors. And we identified that certainly chlamydia and gonorrhea and possibly syphilis are increasing among older women in Australia. There are certain challenges for accessing sexual health care. So for example, there are knowledge gaps regarding what is normal aging. So should I actually talk to my doctor about this, or should I just put up with it? People aren't sure what's treatable. There can be gaps around understanding STI transmission and STI symptoms and safer sex, perhaps not the basics of what it is, but certainly how to do it and how to sort of make it seamless in one's sexual interactions. These are issues we deal with at any stage of life, but they affect older adults as well. As I mentioned before, there's also the pervasive idea that older adults are not sexual and not interested in sex. That can be a really big barrier for having conversations, whether it be between friends or between healthcare providers and older patients, etc. So as we can see here, sexual health conversations are uncommon between GPs and older patients. And I'll talk a bit more about that soon, but basically it's a bit of a stalemate between who's going to bring it up. GPs are comfortable to talk about it, but are sort of unwilling to broach it, don't want to pry, whereas older adults, it may not be the top concern, but it's there amongst the list. They just don't quite feel confident bringing it up. Sexual health is not included in the 75 plus health check. Okay. A bit of a lens on the rural older population. So 1 in 3 older Australians live in regional and remote areas, and there's a higher proportion of older adults, certainly in inner regional areas. Older adults in rural and remote areas may also have higher rates of chronic conditions. So these just may be of relevance if you're working in rural contexts. So some additional challenges of accessing sexual health care in rural settings. Again, many of these affect younger people and other age demographics, but just to focus on the sort of additional layer of challenge an older person might encounter. So privacy and confidentiality concerns. It may be that your doctor is also your friend's child, or who knows what it is. You might just feel like you don't feel super comfortable because confidentiality, although it should be assured, you might just feel like it's not. There may be a requirement to travel to see specialists, for example. In rural areas, there are often longer wait times to see a GP and other healthcare services. There's also an increasing corporatisation of general practices, which can mean there's less flexibility. So for example, consultation times might be more sort of shorter and prescribed, and these can really be barriers for people kind of feeling comfortable and getting to the point of talking about sexual health issues with their healthcare providers, their GPs and other healthcare providers. So some other challenges, there's often a higher turnover of healthcare providers in rural settings. So if it's a matter of building trust with a healthcare provider, you might have to begin again, a few years later to make that trust again. There are also fewer choices of healthcare providers and GPs in rural settings. So you may, for example, prefer to talk to a GP who's not your regular GP, but there might not be an option for that, at least not with a long wait. You may prefer a healthcare provider of a particular gender, but not have access to that person in your setting. There are also more overseas trained doctors in rural areas, and that's great. We love the overseas trained doctors, really, really important. But there can be cultural gaps depending on the patient's cultural background, the GP's cultural background, which can present a barrier to these conversations. So some of the research to date on older Australian sexual health. So not the most recent, but the most recent we have data from. The second Australian study of health and relationships included participants from 16 to 69. Not sure why they make the age caps on the top, because I'm curious about people in their 70s and 80s and so forth, but that's another problem. That identified that there was lower condom use and STI knowledge among older demographics. Also, data collected in 2015 for the Sex, Age and Me study, looking at participants 60 and over, showed that those participants had good STI knowledge, however low rates of testing. Even for those who may have been at risk of an STI, there was low STI testing. There was an interview component of that study, and they said that the participants said that that age-inclusive sexual health promotion and services was a real priority because they didn't feel really comfortable accessing services. Understandably, most sexual health promotion and services are targeted to younger people and other priority groups, fair enough, but everybody needs these kinds of services, and it can be tricky for older adults to find services that suit them. Now, looking at the SHAPE project, so this is the immediate predecessor of my own PhD research. SHAPE stands for Sexual Health, Ageing, Perspectives in Education. It was run by my PhD supervisors in 2016-2017 and explored the barriers to sexual health discussions between healthcare providers and older patients. And in FYI, this project came out of one of the previous CERSH conferences. So, in one of these conferences, as I understand it, a healthcare provider said, but what about older people? I'm encountering these scenarios in my practice and I really don't know what to do. And that's when the light bulb went off to begin this project. So some key findings from the SHAPE project were that, as I mentioned earlier, older adults want to discuss sexual matters with their GP and healthcare provider, but might not initiate the conversations. GPs are willing, but may not initiate as well. They tested a checklist tool, which might help facilitate these kinds of conversations. And these kinds of things can be really useful. Some sort of digital thing in the waiting room, or a paper checklist, or an email you do beforehand that lets your GP know, actually, this is something I'd like to talk about. But onwards, then the SHAPE 2 survey came along. So this is part of my PhD research, and the purpose of this survey was to examine the sexual health information-seeking behaviours and preferences of older Australians. So my background is sexual health education, sexual health information, health promotion, and I'm really curious to know, are older adults looking for sexual health information? If so, where are they going? How satisfied are they with the information they find? Because as far as I know, there's not a whole lot targeted to older adults. So in this survey, I was looking particularly at participants aged 60 over and living in Australia. That's one of the flyers that I used to promote the survey. So this was an online-only survey, largely to do with COVID. Ask me if you really have any interest in the methods. But anyway, basically online survey, and conducted in 2021. So as I mentioned, key questions were, have you sought sexual health information since turning 60? Where did you seek it? What topics did you look up? If you didn't look for information, why not? And also, what makes a sexual health information source trustworthy and acceptable for you? And what is your most, there were a couple of really great free text questions that I asked and got great responses to, and this is going to be the bulk of what I'm going to present next. I asked, what is the most important sexual health issue for you? And what are the barriers that you experience in addressing your sexual health? And I obviously asked a raft of demographic and behavioural questions. This is what the survey looked like. It's a standard Qualtrics survey, if any of you use Qualtrics. In terms of the survey sample, I'll just kind of gloss over this, but essentially it was a pretty good split between male and female participants. We had a few gender diverse participants. Just over half the sample were in their 60s and a bit over half were in their 70s, 80s, and our oldest participant was 92. Oh, yeah. Yeah. I won't go into that any further. ACT slightly overrepresented. Don't know about that, but anyway. And also, just for your information, there was a although it was a convenience sample, it was fairly representative in terms of metro and rural regional split or spread. And actually, particularly for the Victorian sample, we had a higher representation of people from non-metro postcodes. So key finding was that 44% of our sample, and sorry, I should have mentioned on the previous slide, we had 1,470 people, which was pretty good. So 44% of those people had looked for sexual health information since turning 60, and of those people, 67% went to their GP and 42% went to a health website. There were also a range of other sources, online videos, reading books, talking to your friends, etc. However, only 59% were satisfied with the information they found. So they perhaps felt that it was incomplete, or they might have even found they couldn't get answers to their question. There was a really wide range of topics that people were seeking information on, and I really can't emphasise enough how broad it was. And so we had questions around sexual pleasure and sexual technique. We had questions around recovering from sexual trauma. We had questions around navigating desire differences in relationships, all sorts of things. However, sexual function was the area that people were most asking about. So erectile difficulties, vaginal dryness, and these kinds of things. So now I'm really moving on to the quotes from participants. I really want to bring these issues to life for you. So in response to the question, what is the most important sexual health issue for you? Remember, this was, a typed free text box. So we have short but pithy responses from people. This woman in her 70s, the most important issue for her was an acceptance by others that I'm still a sexual being. This woman in her 60s in regional New South Wales, most important issue, ability to discuss safely and openly without feeling I need to be mindful of not making my GP feel embarrassed. So I've chosen these quotes for their possible interest to this audience. It's not necessarily representative exactly of the sort of weighting of the concerns we had, but I think they'll be of interest to you. Here we have a man in his late 70s, regional Tasmania, Parkinson's disease effect on sexual activity. So often we can particularly asexualize those who are older and dealing with chronic conditions. Oh, it's probably not a priority, you know, they've got bigger concerns. These are actually major concerns for people as maintaining intimacy during, you know, illness and aging. This is a nice one, a woman in her 80s. Her most important issue was being in a loving relationship, which she goes on to explain. Quieter now, but still very sweet after 60 years of passionate lovemaking, slowing to sweet and tender closeness. This man's main, most important issue is being able to enjoy masturbation for many years to come. And it can be, you know, a super satisfying physically and sort of emotionally satisfying part of people's lives, even if, you know, solo sex is their preference or all they have access to, you know. So barriers to addressing sexual health. So another question I asked was, what are the barriers to you addressing your sexual health concerns or managing your sexual health? So actually, in response to a question, why haven't you sought sexual health information since turning 60? This person here, this man in his 60s, said, probably worried about what my GP or others might think locally, bearing in mind that all these quotes are from people in rural and regional settings. So that was why he hadn't sought information. And this person describing a barrier here, I find this one very sad. My partner and I have a high level of intimacy. However, we don't have intercourse because my husband had genital warts and I don't know if it's an STI and I can catch it. I'm too embarrassed to ask anyone. So these are real people walking around our communities, our neighbours and our patients. And this person could be, if they want to be having intercourse, you know, could be reassured actually. This person is a little embarrassed about discussing this with a male GP, so emphasising that gender difference is a barrier to her getting her sexual health needs met. I've got a couple of quotes here regarding access to LGBT-friendly services, which can be a particular challenge in rural and regional settings. So this woman in her 60s in New South Wales, the barrier for her is access to gay-friendly services nearby. This other person here, I'd like someone professional to talk to about being genderqueer, as local medical people in my regional areas do not accept anyone different, and in a smaller regional community, privacy is far from certain. This leaves me feeling very isolated and lonely. I like this one. I feel embarrassed to ask my surgeon when I can resume sexual relations. I get information about when I can peg clothes out on the line again and lift something, but nothing about having sex. This is actually part of a longer quote where she goes on to say, I never peg anything on the line. It's quite good. But you know, you can see that this, I don't know what this person's health concern is, but this is a real opportunity to make sure that, you know, that they're having those conversations. The surgeon should really be more onto it than that. I never get to discuss these issues with my doctor, as there are so many other pressing health issues that take up the very short time I have with him. So health, you know, time can just be a real barrier. So that's the end of the quotes I'm presenting to you. These, as I say, are real people in our communities around us. So in summary, many older adults do seek sexual health information, mainly from their GP. Many older adults have varied concerns and priorities regarding sexual health. I'm actually remembering now, and I should have included this quote. There was one person saying, I still have a libido at my age, and it worries me. You know, why is this happening? I thought I would not be sexually interested at this age. And in one sense, that's funny, but it just really speaks to the internalized messages people get around what's appropriate sexual expression as an older age. So just older adults do have varied concerns and priorities around sexual health, concerns or interests around intimacy and communication, sexual function, as I mentioned, pleasure, the impact of aging and chronic conditions on their sexual lives, and they do want to discuss sexual matters with healthcare providers. So all that to sort of bring it together in one little call to action slide. Sexual health matters to many older Australians. So if you work in sexual health, as many of you do, consider inclusion of older ages. And I know that we're often funded to do very specific age groups and all that sort of thing. But if you have the capacity to make resources or to bring older adults into conversations, or even just flag that you're a safe space for people to bring those conversations, it's really powerful. If you work with older adults, consider sexual health, and if you're a healthcare provider, consider sexual health in the overall care of your older patients. So a slide of references. If you're really interested, you can ask me for these, and thanks very much.